Dear friends, I am Vikram Prasad Baliawala in USA. I am a retired family physician and I have my PhD in biology, also taught in a medical college in West Indies. In addition, I have practiced medicine for almost over 22 years. About this disease that I have presented in this video, I had not believed when my wife had started to say that my lips were moving on and off. And when I prepared some videos, I saw that she was right, which she was observing for over a year. Here I want to say involuntary means over which we have no control. And voluntary means we have control over it. For example, we can move our arm. That means it is voluntary. If I cannot move, which will be involuntary, and if it happens itself. So, when I saw some of these conditions in my several videos, I could not believe it. So I went online and did the research, and it says that Tardive Dyskinesia is random, involuntary movement of the face, tongue, lips, or jaw causing lip smacking, puckering, or pursing, which is contracting. And this may happen on and off due to irritation or some other factors when somebody is, sitting and thinking. So, a tardive dyskinesia in my case and all of others, is it a concerning disease? I don't think so, in my opinion. I found out that it may happen due to some medications, and usually antidepressive medications or antipsychiatric medications, which I do not take. Of course, I take, in my age of 80, I take different medications, my baby aspirin, and some other medications for my early diabetes, and controlling my cholesterol, blood pressure, etc. So are they responsible for doing this? Also, I want to say that I do get a estrogen injection, and I will explain about that some other time in another video, why I do take. So is that causing that? The concerned physician told me no. So, so what is this repeated involuntary lip bites or cheek tongue bites, which I have presented in this video, especially about the tongue bite, which is was very concerning to me. So anyway, my diagnosis as a family physician is tardive dyskinesia, and I may be wrong, and viewers may correct me if I'm wrong in the comment section. So thank you so much for watching my video, which may be of interest or may not be of any interest to some people, but those who are senior citizens or retired citizens or retired people, it may be worth watching and observing. In fact, senior people have several other diseases, which some of them have been presented in videos. So here, this is just one such case because I had this problem, and as I said, even my doctor, my internist doctor, family physician, had not diagnosed it because he would observe me only for a few seconds when my wife was watching for hours when I was sitting in my family room. So again, there are several stories that some medical conditions have been diagnosed by the viewers of videos or by people around you. And one case is well known where a physician observed a lady who had enlarged gland in her neck, and he says, called that person and said, possibly you may have a thyroid condition leading to a cancer. And it turned out to be a correct observation. I do not know the complete result of that, but I'm just saying that people around the person can observe. Even in schools, I have seen in primary schools, teachers will tell such and such, a student, you have been, having this kind of problem, and to see a doctor. So this is not uncommon, and it should be pointed out. The other example in my knowledge is the petit mal seizure, which patient does not know and will be staring for some time, and then person around that child, usually a person or adult, will tell, hey, you are staring somewhere else. Are you aware of it? And the person concerned will say, no, I don't know if I was doing it. So there are several conditions that could be observed by people around you and should not be ignored. Seizure is another example, seizure or मूर्छा. सो भाई मेरे हिंदी स्पीकिंग भाई बहनों, ये मैं कहना चाहता हूँ कि कोई भी कंडीशन जो हो उसको आप इग्नोर नहीं कीजिएगा. सो थैंक्स फॉर वॉचिंग माय वीडियो.